Okay. Again, I'm Mary Newman with the Sudden Cardiac Arrest Foundation, and our speaker today is Dr. Kate Flickinger. Um, Kate is from the University of Pittsburgh. She's an exercise physiologist, American College of Sports Medicine certified personal trainer, and exercises medicine 2 provider. She's a researcher in the Department of Emergency Medicine, and she's completed her postdoctoral training as the principal physiologist managing the department's Applied Physiology Lab, working, working also with the post-cardiac arrest service. Her webinar today will focus on exercise and exercise strategies, safety, and staying motivated after cardiac arrest. So take it away, Dr. Flickinger.
Thank you, Mary. I appreciate that. I will go ahead and try to share my screen. Before I get started, I am pretty informal generally, and I'm also very bad at checking the chat during Zoom webinars. So if you have a pressing question, I will not take offense. If you want to stop me before the end of the presentations, we can answer questions as we go along. And I will work on sharing my screen. Okay.
You see? You see?
Can you see?
Mm-hmm.
All right. Is everyone able to see my screen okay?
Yes.
Yes,
All
sir.
right, perfect. Thank you. Again, I'm pretty informal, so if you have questions, you don't have to wait until the end. Before I get into it, today's content is to be informative only. Please talk to your physician before you start anything new or changing anything to your exercise program. These are just general guidelines to help you get motivated and stay inspired, especially if you're hitting a rut, and just to share some of the things that other cardiac arrest patients will experience, to know that you're not alone in a lot of this. So again, I want to emphasize, please check with your physician prior to making any changes. So exercise or physical activity, is it a cure-all? I like to say yes. This cloud chart here, this is just a short list of the many things that physical activity can help improve. Congenital heart disease, coronary artery disease, anxiety, sleep, weight management, osteoporosis. All of these things are impacted by your physical activity. CT, did you have a question? Okay. So, every system in your body is impacted by physical activity. And physical activity can impact your body both immediately and long-term. So immediately, after you do a bout of exercise that night, you should have improved quality of sleep. You should have less anxiety. Your blood pressure will decrease or stabilize to a more healthy range. Long term, it can help improve your brain health. It reduces the risk of developing dementia or Alzheimer's. It also reduces the risk of depression and, like I said earlier, reduces anxiety. It improves your heart health, lowers the risk for heart disease, stroke, and type 2 diabetes. It reduces cancer risk, and of at least 8 cancers that we know of. And as we're continuing to do more and more research, we're finding that physical activity impacts more and more of these cancers that people are at risk for. It helps you keep you at a healthy weight, which again impacts all of your physiological systems. Improves your bone strength, your balance, and your coordination. So, all of us, aging is a privilege, but as we get older, our bone strength and our balance and coordination are really important. We all want to, I think it's safe to say that we all want to age comfortably. We want to be able to get up off the ground as easily as possible. We want to be able to we don't want to be limited by any of our activities. So if we can, work on these things now, then it will help us in the future. And it also has mental health benefits. So this is still new and emerging research. it sounds silly, but even just a short walk can have major improvements in your mental health. There's the meme of someone saying, I'm going on a stupid walk for my stupid mental health. And while that sounds silly, there's actually enough research proving that just a short walk, even as short as 10 minutes, so something around the block, can drastically improve your mental health. It can, again, reduce your feelings of depression and stress. It can increase your energy level. It sounds counterintuitive that, oh, you're going to go and be physically active, but your energy is going to increase because it's boosting your mood, because it's getting your circulatory system going. It's going to make your battery stores larger, if you will, as you consistently do it. So you'll be able to do more with less energy expenditure for that. And again, improving sleep. And sleep is important for all of us. And it can also impact all of these things too. It's a circular trend, if you will. So this is just a nuance of what is the difference between exercise and physical activity. So physical activity is any movement that requires energy. It's generally unplanned, like your activities of daily life. So your household chores, if you're gardening, if you're walking from the parking lot into a grocery store, things like that. Whereas exercise is planned and structured, often repetitive, and it's a subset of physical activity. And the objective of doing exercise is improvement or maintenance of physical activity or physical fitness. So, weightlifting, running, cycling, golf, horseback riding, things like that. So all exercise is physical activity, but not all physical activity is exercise. So that's just a brief overview of, the importance of exercise in general. But what about exercise after cardiac arrest? After experiencing a cardiac arrest, you or your family member, you've gone through a lot. And it can feel ominous to say, oh, no, I need to go and walk, or I need to go and lift weights. What if you didn't get therapy, physical therapy or occupational therapy or anything like that? How do you even begin? So these are the things that I want to cover for everyone. So what if you didn't go to physical therapy? Unfortunately, Medicare only covers cardiac rehab for 8 specific criteria, and insurances generally follow the same specific criteria. So those are if you've had a heart attack within the last 12 months, if you've had coronary artery bypass surgery, current chest pain, but it is stable chest pain, if you've had a heart valve repair or replacement, if you've had a coronary angioplasty, so a medical procedure that opens a blocked artery, or a stenting, that's a procedure used to keep an artery open. If you've had a heart or lung transplant, or if you have stable chronic heart failure. But you could have had a cardiac arrest and not met any of that criteria. So what are you supposed to do? We've learned that if you're a military veteran, you can check if there are services
in a
available.
lot of ways to these people who were elevating.
I'm sorry, what, Corey?
I'm sorry.
Oh,
No. Yeah, I'll put it on mute.
okay. So if you're a military veteran, you can see if services are available at the local VA. There are other rehab options. You can chat with your physician. It doesn't matter if you had a cardiac arrest a week ago, 2 months ago, 2 years ago. If you are experiencing symptoms, physical symptoms or emotional symptoms, still tell your physician, hey, I'm still struggling with these things. I was wondering if there is something that I can do about it. And if you're still experiencing physical symptoms, they can still prescribe you physical therapy, occupational therapy, things like that. Some cardiac rehab facilities will also allow you to pay to work out at their facility. And if you aren't aware of what the difference is between regular physical therapy and cardiac rehab, is that you are generally doing exercise under physiological monitoring. So you're wearing a Holter monitor so that they can check the rhythm of your heart while you're exercising. And then it is more structured with the intention of improving your cardiovascular health, whereas physical therapy generally focuses on if you have, back problems, how to strengthen your back. But that doesn't mean that it's not beneficial for you. Again, if you're still experiencing symptoms from your cardiac arrest, no matter how long it's been, speak up. I am not the only person who has felt like going into the doctor's office is a revolving door. And it is not because the physician doesn't care. It's because the physician is only allotted a certain amount of time to see you. And that is a different problem. So if you don't speak up, they're going to assume that you're not having a problem. So speak up, and speak up early and often. Another option that can be more affordable is to check your local YMCA. If you're over the age of 65, I believe, you can get a free membership at the YMCA. And some YMCAs will have what they call phase 4 cardiac rehab, where they'll have a sign on the wall that gives you, what the next phases would be in cardiac rehab. If you wanted to continue on after you've graduated, or if you didn't qualify for cardiac rehab, but you're cleared for exercise. Other cardiac rehabs may also have scholarships available if you can't afford cardiac rehab. I know that other facilities will also do more of a consult with you. You go in once, you wear a Holter monitor, they give you examples of exercises to do and a program to go through, and then they let you fly on your own. Please don't just sit there and suffer. That's not what we want to do, or what we want you to have to experience. And since with cardiac arrest patients, there's not a standard of care. If you have a stroke, there is a stroke rehab and a step-by-step guideline to get everyone back to normal. But that's unfortunately not the case. This is not something that, comes from the University of Pittsburgh. But my opinion is, if you've had a cardiac arrest, you should automatically qualify for not just cardiac rehab, but any sort of physical therapy or rehabilitation that you need, depending on what your deficits are. So again, if you're experiencing physical pain, mobility issues, trouble with daily activities like showering, talk to your physician about starting a rehabilitation program. Someone can even come to your house to do it. Just because you weren't provided with these options upon discharge doesn't mean that you can't ask for it later. Sometimes you may have been referred, but if you were discharged with a giant stack of paper, it could have gotten lost. So please speak up. Some of you will get an ICD or an implantable cardioverter defibrillator. Wait until your follow-up appointment to be cleared by cardiology before you return to physical activity. Stay within the guidelines provided by your cardiologist or your electrophysiologist. And exercise restrictions and ICD set points will vary from person to person. These are individualized, and these are set points that are very specific to you to keep you within bounds so that your ICD doesn't fire. So if you know someone else who has an ICD, don't be concerned if yours differ from someone else that you know. But depending on the cause of your cardiac arrest, your physician may recommend you wait for a few weeks before engaging in exercise. And they may recommend completing an exercise stress test. I'm not sure if anyone has done an exercise stress test or not, but for those who aren't familiar, you generally wear a more extensive Holter monitor so that they can check your heart rhythm while you are either riding a bike or you are running on a treadmill, and they see how your heart can keep up with the increasing intensity of the exercise. Let's see here. Some may also recommend that you've gone at least 3 months without the ICD firing prior to resuming physical activity. Again, don't be alarmed if you were told to wait 3 months and someone else wasn't told to wait 3 months. Stick with what your physician recommends. Your physician may also say wear a heart rate monitor to keep your heart rate below a certain rate. Again, to prevent the ICD from misfiring. Your maximum set point might be 150 beats per minute. So they might say, keep your exercise to under 140 beats per minute. But generally, I understand after an experience like this, it can be terrifying to do something physically active, especially if you had a cardiac arrest while you're doing something physically active. But moderate leisure time physical exercise is generally safe and is actually recommended for most individuals. And it can also act as secondary prevention to reduce the risk of ICD shocks. With our post-cardiac arrest service, we've had patients who have had a cardiac arrest during a run, and the next year they went and re-ran that race. And that's incredible. Not everyone can do that, but that's more to inspire you to tell you, if you aren't given restrictions from your physician, please, feel motivated and feel confident going ahead and doing whatever it is that your heart is calling to you. And for those of you who are just terrified that your ICD is going to go off, a meta-analysis which accumulates all of the results from many research studies found that in a subset of 635 patients with an ICD, less than 1% had ICD missed shocks. That was 6 people out of 635. Now, that's not zero, but that should give you a little bit more confidence. But again, like I said before, you went through a very big experience. Give yourself time. As a general rule, it takes twice as long as your hospital or rehabilitation stay to recover to your previous strength. So if you were in the hospital for 2 months, it would take at least 4 months to start to feel like your previous normal. And you need to remember that depending on how long your hospital stay was, you might need to look for a new normal. Some physicians will also say that instead of taking twice as long as your hospital or rehab stay, it could take 3 times as long. So if you're in the hospital for 1 day, it'll take you 3 days to recover. So when you leave the hospital, you may need support to complete the physical things that you need to do. Chores, driving, taking out the trash, unloading the dishwasher, especially if you have an ICD and your physician wants you to wear a sling to try to prevent your arm from moving too much. It's things as easy as taking your shirt off or reaching to put the dishes away. Those things can be challenging, and it's okay to be frustrated. But following these plans that your physician gives you and saying what you're specifically struggling with can help you get stronger and get back to doing your activities and chores as fast as possible. You might need to be off of work for some time after discharge, especially if you work in a physically active or physically demanding job. So if you have had a recent cardiac arrest, ask your doctors how long you must be off of work. Can you slowly go back to work and be cleared for, part-time or with some restrictions and slowly ease back into it. Again, you might have other physical restrictions, including not being able to drive for some time, but these restrictions are generally common and temporary, so you're not alone. A lot of individuals will experience difficulty walking, balance and mobility and strength. You feel very weak, especially if you've been in the hospital for a long time. Difficulty with your balance, difficulty with driving. Some people will experience shakiness or tremors in their hands or their feet. You might need help getting dressed or using the restroom, showering. You might have a lot of chest pain if you received CPR or from your defibrillator placement. All of that is normal. And it's okay. So just know that you're not alone in any of those things. If you're concerned with all of them, again, talk to your doctor. We don't want you to go home and just sit there and worry and feel like you don't have any resources and that you're drowning in, I don't know what to do or where to start. So with that, after you've given yourself time, and again, you have been cleared by your physician, how do you start an exercise regimen? So you start slow and you can set what we call SMART goals. So what are SMART goals? They are specific, measurable, attainable, relevant, and timely. So specific, what do I want to accomplish? Measurable, how will I know I've accomplished it? Can my goal even be accomplished? If you've never ran a day in your life and your goal is now to run a marathon, might not be the best goal. Start small. And relevant. Is my goal relevant and worthwhile? And when can I accomplish my goal? If you are a runner, maybe don't say, I would like to run a half marathon within 3 months. Give yourself realistic, realistic guidelines, realistic goals. Consider starting with something as easy as short walks and gradually increase the length and intensity. So, what does this look like? Instead of, to get specific, instead of saying, I'm going to exercise more, go for, I'm going to walk for 15 minutes every day. Measurable, set a timer on your phone for 15 minutes every time you go out on a walk. Or if you have a walking pad in your house, say, I'm going to walk for one episode of whatever TV show I like to binge watch after dinner. Again, make sure that you can achieve your goal. If you're back to work and you're working 80 hours a week, you likely don't have time or the energy to walk for 2 hours a day. And make sure that your goals are within reach. Again, if you haven't ridden a bike for 15 years, your initial goal shouldn't be to ride your bike for 10 miles. And then timely, again, when do you want to be able to reach your goal of walking for 15 minutes a day? You also want to make sure that these goals are a little bit of a stretch, depending on your flavor of what kind of motivation you need. Do you need a little bit of stretch, or do you need something that without a doubt you can attain? Try it out, and if you fail with one, try with another. Sometimes for me, whenever I'm starting a new form of exercise, I like to start with the low-hanging fruit, the goals that I know that as long as I stick to it, I'm absolutely going to be able to achieve it. And then once I'm in the groove of it, that's when I try to make these goals stretch a little bit further. Again, making sure that I know that they're realistic and achievable, but they're a little bit more outside of my comfort zone. And I want to emphasize the fact that this isn't all or nothing. So say you intended to exercise for an hour, but you only have 30 minutes by the end of the day. The dog had an accident in the house, or the kids needed more help with homework. Just do the 30-minute workout. If you feel too tired to go to the workout class that you really wanted to go to, take a 15-minute walk instead. Or if you really wanted to go to that workout class, but you don't have the full hour in you, tell the instructor ahead of time that you'll be leaving early and stay in the back of the class, and then leave whenever you feel like you can't do it anymore. Some movement is always better than no movement. It's not all or nothing. All of these physical activity and exercise, it all compounds. So the more that you can do, the better, but it's not, oh, I can't do my class, I may as well just sit on the couch and not do anything. Something is always better than nothing. Motivation is really hard, especially for me to get outside. Living in Pittsburgh, the seasonal affective disorder is very strong. So these are some goals and tips from the National Institute of Health in their Department of Aging, of finding of like what to do if you're just not feeling it. Find ways to fit exercise into your day. You're more likely to get moving if it's a convenient part of your day. Is it convenient to take the dog for a walk in the morning or after work or during your lunch hour? If you say, I must work out and go to a 6 a.m. spin class and you're just not a morning person, don't do that to yourself. You don't need to cause that kind of pain and suffering. And again, do activities that you enjoy, make it fun. Don't do the boot camp because you think you should do the boot camp. If you like a Zumba class, go to a Zumba class. If you like to horseback ride, horseback ride. If you get bored doing the same thing day in and day out or month in and month out, go to a different class all the time. There are now, I believe it's called Class Pass, and it's where different gyms and classes will allow you to have a membership within ClassPass so that you can go to yoga at one place, go to a spin class at another, and go to Pilates at another place without having to have a full-blown membership at each of these facilities. Bring a friend or call a friend whenever you're walking. Do whatever you need to stay motivated. Make it social. Again, if it's, hey, I'm only going to call my best friend who lives across the country when I'm walking, that's extra motivation. By the time you get started and it's 30 minutes and that's how long you planned on walking, your friend might still be telling a story and say, hey, do you have 10 more minutes to walk so that I can finish my story? That's great. Go for it. Once you get started, and if you have someone to keep you company, that's great. And there's inevitably going to be a break in your routine. It's okay, and that's okay. It's expected. You're going to get sick. Oh, Mary, you have your hand raised?
Can you hear me?
Yes.
Okay. Yeah, I was just going to point out that Francesco and Craig both have comments in the chat.
Oh, okay. I can't see them. Do you mind reading them to me? Let's see here.
Or Francesco, do you want to read yours?
Hi there. Just make sure you can hear me from the
Yes.
UK. Yep.
Yes.
What it is I think everybody's in a different place depending, if you're working full time, if you've got a dog, if you can actually exercise, if you belong to a gym. I'm retired, so I've got time on my side. But when I came out of hospital after a cardiac arrest with an ICD, also came out with a diagnosis of heart failure, class 2. So all those symptoms of breathlessness, tiredness, fatigue, fluid accumulation, I have to say I've never experienced them because the first thing I did when I came out of hospital was to increase my cardiorespiratory fitness. And that was what, 5 years ago. And to be quite honest, I'd have to question my cardiologist diagnosis or the echocardiogram, say that I've got a reduced ejection fraction of 30% with a class 2 diagnosis because I don't feel any of those things. But then I exceed and double what the World Health Organization has got to say about vigorous activity, 75 minutes on 5 out of 7. I double that on 7 out of 7, and I've done it. I've never gone below 8,000, and I take coenzyme Q10. But maybe that works for me, and it might not work for others. Really got any other long-term conditions that would, like COPD or pulmonary fibrosis, anything that would impact my breathing. So I think it's very personal, and somebody like your good self, Kate, as an exercise physiologist, would be helpful to enable people because in the UK we've got the Health Unlocked website, which is mainly run by the British Heart Foundation, and anxiety, uncertainty of people even going for an angiogram seems to create the anxiety before it's actually taken place. And it certainly takes place after, whether or not you've had a mitral valve regurgitation, repair or replacement, or aortic valve. So, I think we're all different people with different levels of concerns. Damn it, I'm still stood upright, so I'm happy. So my biggest concern, because I've had 3 previous heart attacks and quadruple heart bypass, was heart failure was new to me. So I had to learn how to deal with that. I could deal with, coronary arterial disease and the other things that go with it, but heart failure, that was things for older people, and that came about, as a result of unplanned activity, as a result of the cardiac arrest. That's what they found out. I didn't experience anything before that, but there you go. We are where we are. Cheers.
Yeah, thank you for sharing. It's very true, and I did see that Craig shared in the chat as well. I did figure out how to see that. Yeah, not everyone is able to return to their previous normal. You have to look for what your new normal is and go from there, and figure out what works for you. Every person who has a cardiac arrest is different, so their experience is going to be at least a little bit different. And so you want to make sure that you're setting goals and expectations that are reasonable within what you are able to what you're able to achieve. Because it doesn't feel good to set a goal that you know that you can never reach, and that's going to disempower you, and that's not what we're here to do. So what can you do within your capacity? And giving yourself time to adjust and adapt and recover. And if you're still struggling, talk to your physician. And if your physician just says, I don't know, it's okay to also find a new physician. That is an option. Any physician who says that their word is gospel, maybe question that. Yeah, so thank you both for sharing your experiences with that. I guess I will get back into motivation, unless anyone has another question. I don't think so. I can't see everyone. Okay, thank you. So again, if there's going to be a break in your routine, you're going to catch a cold, you're going to go on vacation, you're going to go to a barbecue, that's okay. You need to live. You deserve to live. You should do those things. Start slowly and gradually and build back up to your previous level of activity, and ask your friends and family for support. If you go on vacation and you drink umbrella drinks for a week and don't do a whole lot of exercise, that is okay. I call that soul food, which you need to nourish your soul too. But don't expect to pick right back up with your exercise routine from where you left off before you went on vacation. Go back a couple weeks and see how that feels and build back up. And just rather than saying, I'm never going to take a break, build it in. If you can't travel, if you're immunocompromised and you're working out at home, and you're not going anywhere, still give yourself a break. Say, I'm going to, do 4 weeks of exercise, and then on the 5th week, I'm going to allow myself to binge watch as much Netflix and Hulu as I would like, or something like that. Build that into it. Allowing yourself that rest. And then keep track of your progress. It's fun to see how much progress you've made. If you're walking and say, oh, I used to only be able to walk for 10 minutes and now I can walk 15 minutes. That's big. Small steps build up. The turtle that wins the race, slow and steady. And it's good to look back, especially when you're not feeling motivated. If you look back to where you've started, and see, hey, I've made some progress, that alone can get you going and keep you motivated. If you want to either keep track on a smartwatch or your phone or old school pen and paper, that's great, but it's fun to have that reference and to look back. And then Francisco talked about current guidelines for physical activity. They change a little bit based on if it's the National Institute of Health or the World Health Organization, but they generally say you want to get moderate intensity of aerobic physical activity for 30 minutes, 5 days per week, which is about 150 minutes total. Or if you're cleared by your physician, vigorous intensity aerobic physical activity for 75 minutes per week. And that's including strength and conditioning activities that engage all major muscle groups at least twice per week. Just cardio isn't enough. Resistance training, and that doesn't mean you need to look like Arnold Schwarzenegger in the weight room. Even body weight resistance training or bands. Resistance training and building muscle mass is a major factor in your overall morbidity and mortality. Again, having that muscle strength and that mobility and that balance, that's what helps you be able to play on the floor with your grandkids and be able to get up on your own. And that's, I think what all of us would want. This is the minimum recommendation in order to reap the benefits of that word cloud that I showed earlier in the slides, of reduced blood pressure, reduced insulin resistance, and improved weight management. This isn't necessarily for weight loss. There are more specific guidelines online for both the World Health Organization and National Institute for Health for individuals, and physical activity based on if you suffer from cancer or arthritis or COPD, children, elderly, those with autism or asthma, etc. So if you want to look to see if there is a specific guideline for those as well, look them up. The American College of Sports Medicine, World Health Organization, and Center for Disease Control, they all have resources. They don't have resources for cardiac arrest patients. which is why I'm here today. And here's just the World Health Organization's another diagram of what kind of exercise you should be able to do. If you can do more than this, by all means, that's okay. Again, I can't emphasize it enough of make sure that it's safe to do so. There is such thing as too much exercise. So, I talked about vigorous intensity and moderate intensity of exercise. What is intensity? So it's how hard you feel you're working during physical activity. How much effort are you using? And it's subjective, meaning you decide how hard you feel you're working during the activity. There's no right or wrong answer. It's just how you feel in that moment. And if you did go to cardiac rehab or physical therapy, at any point, you may have heard the phrase rating of perceived exertion, or RPE. And these are commonly used at cardiac and pulmonary rehabs. Different facilities will use different ones, but the most common ones are the Borg 6 to 20, the Borg 0 to 10, or the Omni 0 to 10. And Borg is just the last name of the person who invented the scale. But they're all validated, so don't think that one is better than another. But I wanted to show those to you so that you can get an idea of what vigorous and moderate intensity exercise is. And if there's a scale that works better for you to follow, so that whenever you are at the Y, if your doctor says do moderate activity, you can look at these. You can Google them too, of what do you consider, moderate intensity exercise. So I'm sorry, this got cut off a little bit. So this is the Borg 6 to 20. So it starts at 6 and goes all the way up to 20, and 6 is no exertion. You are laying on the couch watching Netflix. Light is a slow, leisurely stroll. All the way up to 20, maximum exertion. You're working the hardest you've ever worked physically that you can ever remember. You are sprinting up a hill. And then we get to the Borg 0 to 10. 0, again, that's equivalent to the 6, nothing at all, laying on the couch. And then it goes all the way up to, very, very hard, your maximal, the hardest you've ever worked. The Omni scales, they have more visuals based on the activities that are being performed. So how hard is it? How hard are you riding your bike? How hard are you running? How hard are you going up the stairs? And there are more than these ones here, but those are just the most common ones, and I thought they were useful for this. And we're talking about intensity. Again, don't forget about rest. Resting is just as important as exercise, especially with resistance training, which is important for everyone. You need to rest to allow your body to recover, and that will help you maintain your cardiovascular health, your musculoskeletal health, the muscle that you're trying to build, allow it to build and recover. And if you're feeling sore, that's all the more reason to move. If you lifted weights at the Y, you did one of the circuits and you're feeling really, really sore, and you planned on doing a spin class and you say, that sounds terrible, go for a walk, do some yoga, do some stretching, still do something. There's also recovery, they call it LSD, or long, slow distance. So even just going on a long, slow, leisurely stroll through the neighborhood just to get the blood flow going and move your muscles can help you feel better later. If you do exercise later, there's delayed onset muscle soreness. So you might not feel sore later that day or even the next morning, but 2 days later, you feel very, very sore. That's an intense exercise. And that's normal. It shouldn't be debilitating though, by any means, but especially on days that you experience that soreness, do something light and easy just to get you moving. Again, it doesn't have to be for forever. Just something to help you recover, to make you feel better later in the day and the next day. And I also wanted to emphasize, when to stop. If you have sudden chest pain that is new, by all means stop. If you are experiencing unusual shortness of breath, wheezing, leg cramps. I mean, if you're doing sprints, obviously you're going to be out of breath. You might experience leg cramps, but this would be something that is unusual. If you're on a walk and you walk the same loop with your dog every day, and suddenly the walk feels a lot harder than it has, earlier in the week and the weather isn't significantly hotter, there isn't another explanation, stop. If you're feeling lightheaded or confusion, nausea, if your skin becomes cold and clammy, if you're experiencing new balance issues and severe fatigue, that's unlikely to be, again, due to the level of exercise intensity. It's not because if you're running sprints, it's a different story. If it's unusual, please stop. And then I wanted to briefly talk about GLP-1s, the Ozempic and Mounjaro. This is a very hot topic. And again, I am not a physician, so I can't talk to anything about prescribing it. There's a time and a place for it, absolutely. And it is useful as part of a comprehensive wellness plan. But for me as an exercise physiologist, I need to emphasize that it's not a replacement for physical activity. If your doctor prescribes it to you, by all means, follow their instructions with regards to using it. But know that you still need to perform physical activity to reap those benefits, again, to make sure that if you're playing with your grandkids on the floor, you can get up off the floor without needing help, things like that. And with that, I want to open it for questions. I do have my email at the bottom. If you have any questions later down the road, whether it's tonight, tomorrow, or a year from now, I'm happy to answer them as best as I can. Again, since I am not a physician, I can't answer very, very specific questions to you, but I can give you some guidelines and send you some resources if you have further questions. But thank you very much for spending time with me.
Thank you so much, Kate. That was awesome. I'm sure there's some questions out there.
Yeah, and Francisco, you were at my last talk a little bit more over a year ago, almost 2 years ago. Is that right?
Oh, he's on mute, I guess.
Yeah. Does anyone have any questions? Any concerns? All you, Francisco.
Yeah, the last thing that you mentioned, I mean, in the UK, yeah, for my heart failure, I'm taking repurposed medication. I can never pronounce it, dapaflorin or something, for my heart failure, which was provisionally for people with diabetes. But there seems to be a lot of, because of the cardiometabolics, connection. It seems that people with other conditions, cardiovascular and otherwise, can take other stuff. Now, you've mentioned there GLPS, but I hope that I get not necessarily the peptide from it, but, from my porridge I take every day, jumbo oats and that, I get my, is it beta gluten? Is that the same thing? Do you know? Maybe
Beta,
not. But
I don't think so. I mean, you try to get as much of your nutrition from food as possible and supplement where it's needed, but GLP-1s are not something that you can get from your diet.
Oh, right, fair enough. There, well, trying to keep it as natural and holistic as possible. Whether or not I can't tell whether or not the medication, the 4 pillars that I take for heart failure, and the exercise and the coenzyme Q10 to give my mitochondria the spark that it needs to produce ATP actually works. I'll be honest, because really I need to go into a clinical trial in both arms, treatment as usual, in the intervention group, because I can't believe that, I've got heart failure, but the echocardiogram tells me otherwise. But with the cardiac arrest, we've got different people, they manage their condition, but unfortunately the people that I come across regionally in the UK, well, in England, anxiety, post-traumatic stress disorder, it's a common feature, which is so unfortunate. I'm just glad that I'm one of the 8% that survive, so I've got no concerns whatsoever. Hopefully my ICD will never go off. but it's there as my guardian angel should I need to be, because I was playing football at the time when mine went off. But in terms of question, it would be great if everybody had access to cardiac rehabilitation, but not only for heart attack, but also for heart failure and, for the various valve replacement and repairs. We'd meet people like you, because when I had my cardiac rehabilitation, we had the dietitian, the physio, the occupational therapist, and the exercise physiologists and that. And it's all very helpful. But unfortunately, the ambition in England is that 85% of people that have heart attacks or otherwise will be offered rehabilitation, but it doesn't have to be face to face. It could be digital, so that's just unfortunate. But that's the plan for 2029, 85%. Anyway, that's me.
I mean,
Cheers.
thank you for sharing that. There are pros and cons to virtual therapies for people that live in rural communities that either don't have transportation or they don't have childcare. Getting physical therapy over FaceTime is better than nothing by all means. But for some people, they really benefit from that sense of community at cardiac rehab or physical therapy. So, if you have access to both, go for the one that you like the most. Some people don't want to step foot in a gym. Something again is better than nothing. I did see that there were some questions in the chat. CT, you asked, is post-cardiac arrest mental health care covered by Medicare, and for how long? So I'm not sure if specific to cardiac arrest, if mental health care is covered by Medicare, but I am fairly certain that therapy, like outpatient therapy, specifically through Medicare Part B, therapy should be covered through that. I'm not sure for how long, but it should be covered. And again, this is you went through a very traumatic experience. You may have woken up to receiving CPR. It's okay to not be okay. Ask for help, talk to someone. Some people might need more therapy, to talk to more people. Other people are blessed, like Francisco, where it is a blessing to be alive, and that is enough to keep you going. But it's okay if it's not. It's hard, and we all cope differently. Some people, just that sense of community is enough. Going to cardiac rehab or joining a walking group. Silver sneakers, walking the mall in the winter. Sometimes that is enough too. Craig, have I worked with anyone with exercise intolerance? I haven't personally worked with anyone with exercise intolerance. I know that it occurs, and I'm really sorry, because that's really, really frustrating. As long as you are cleared to exercise, you're not given restrictions. Sometimes just the really low intensity exercise for shorter bouts is enough to get you started. They're starting to say that things like, they call them exercise snacks. So if you can't possibly bear the idea of walking for 30 minutes, if you can walk for 10 minutes 3 times a day, that's enough. Or if you can even get up and walk for 2 minutes here and there and slowly build up to 20 minutes, something is always better than nothing. If you can't do a full, even 20-minute workout, but you can do 10 squats every other hour, that exercise snack, it will build up, it will compound. And then I think you asked about co-survivors. That should be the same for if you have Medicare. If you need therapy services, it should be accessible to you through Medicare Part B. And at least in the state of Pennsylvania, for therapists or psychiatrists and also physical therapists, you don't need a referral from your primary care physician or from a physician. You can go directly to the source. I know that in the past in Pennsylvania, you needed to go and see a cardiologist to get a referral for rehab, or you need to go to your PCP for physical therapy if you hurt your back. At least in Pennsylvania, you no longer need that. And that's the same for reaching out for a therapist or a psychiatrist. If you're looking for therapy services, Psychology Today, that website is a very good resource to search for providers that are taking new patients, and you can search based on what insurance you have. If you're looking for virtual, if you're looking for male versus female provider, if you're looking for in-person, virtual, combination, all of those are available on Psychology Today. Any more questions? I have to scroll, so I can't always see the hand raising. And again, CASA is a great community and resource to not feel alone. We're here for a reason.
I don't see any other questions in the chat, but we still have a little more time if people would like to raise a question.
Even if it's, a little bit off topic, I'm happy to answer questions how I can. Yeah, and again, thank you for giving me your time tonight. I hope that you found all of this helpful. Francisco.
Yeah. You mentioned about wearing wearables, and I totally agree with you, because I've got my wearable that's linked to my mobile phone, and when I go out for a walk, it can pick up my steps, but when I'm riding my bike, my wearable doesn't pick it up, but my mobile phone in my pocket does. Now, what the wearable can do without a breathing mask is give me an indication of my VO2 max. Is that something that okay, I haven't got a poor score, but I've got what's considered, if it's reliable, a good score. So I don't know whether or not I should feel confident with that, but I know how I feel in myself. It took me 2 years to get my consultant cardiologist to sign a piece of paper to allow me to go back to playing football, because they wouldn't have me back. It's only a kickabout with the lads and that because of their insurance, but he did after 2 years. But I put a little cushion over my ICD just in case the ball hits me in that particular area. And that was, once I got that, everything seemed to be back to how things were. Although I was 2 years older and not as quick as what I was when I was 65. But I guess that comes with age anyway. But yeah, do you think there is a place for people to look at their VO2 max, or is that just maybe a bit over the top? Thank you.
Yes, wearables for me are a really hot topic. I say that while I have 2 wearables on right now. I have my Apple, well, I guess 3. I have an Apple Watch and a Fitbit and an Oura Ring. The Fitbit is for a research study that I'm participating in, and since I'm a data scientist, I love data and I love my own data. I have a love-hate relationship with wearables. They're very useful to give you a delta for things, a change. I would not take them as gospel. So if you're looking to improve your VO2 max and you see, you started at one point and it's increasing, the numbers might not be, they're not going to be as accurate as if you were to wear a face mask and it measured how much oxygen you're utilizing and how much carbon dioxide you're exhaling. But you can trust the fact that your VO2 is increasing. Or if you were sick for a while, if it shows that your VO2 is decreasing, you can take that as it is actually decreasing. And then it's hard to do research on all of these devices because anytime there's a software update, they don't have to tell you what they changed. So if the initial algorithm that they're using to measure your heart rate was to be more accurate for individuals who are 50 years old, but over the past couple of years, the consumer's age has decreased then they might tailor that algorithm to now be more accurate for individuals who are in their 20s and 30s, and they don't have to disclose that. So it makes it very hard to do research on the accuracy of these wearables. And also, if you wear a device and it says you slept terribly, but you woke up feeling refreshed, trust yourself, at least in that aspect. But they do come in handy, especially for individuals who suffer from AFib. A lot of these watches can now detect it, and you can mark it so that you can send the file to your physician. So they do have a lot of utility, and a lot of them are also covered. You can use your FSA or HSA, your flexible spending money for insurance to get these. So there's a lot of pros to them. But the VO2 is generally, it's based on a calculation based on how long you worked out, what your heart rate variability was, which is the difference in the beats per minute. It always changes, like between each individual beat. And then, what is the range of your heart rate per minute through that exercise. And from there, they can approximate your VO2. So you can confidently say, it's a rough estimate that this is what my VO2 is, but generally look to those to quantify a change, not hard numbers.
But just to throw in there, I mean, I may pronounce it incorrectly. I've got a very low heart rate while I'm asleep. Depends how accurate my wearable is. It shows that I'm between 35 and 40, and while I'm resting, like right now, it's about 50. I've never had, 60 to 100. And I take, I can never pronounce Biopsol, Biopsol. I can't pronounce it, but I take 5 mg, but the cardiac consultant is going to I've just had it reduced to 3.75 in order to increase, because there's concern that because I got it so low, another word I can't remember. Is it bradycardia? Thinking that I've got yeah. So I haven't got that, nor have I got tachycardia. But so it's to actually increase. I doubt that it will. Maybe I'm kidding myself that at 40 beats a minute, I'm a supreme athlete, but I'm bloody well not. I don't think so. So I have to listen to their.
Yeah. Playing football, you probably have a higher VO2 max than you give yourself credit for. It is up to your physician as to whether or not 40 beats per minute is healthy for you or not. But generally, for healthy individuals, a lower resting heart rate indicates a healthier cardiovascular system. But again, that also depends on what medications you're taking. If you're taking stimulants or certain heart medications, your resting heart rate isn't going to drop. Other medications, like you said, can give you bradycardia, a lower heart rate. I don't want to say artificially, because your heart rate is your heart rate, but it has to do with the medication side effects rather than cardiovascular fitness. CT, you said in the chat that you like the idea of an exercise snack. So that is there's research coming out on that slowly. I watched a webinar from the American College of Sports Medicine on it. There are some people where planned exercise just isn't something that they enjoy, and that's okay. It is not for everyone. But how do we get these individuals the benefits of physical activity without it feeling daunting or having it feel like it is torture? So these snacks, it is, like I said, it can be something as simple as, every hour on the hour, I'm going to do 10 air squats or 3 push-ups, and, that builds up. You accumulate time and slowly build that up. If you can't do a squat or you can't do a push-up, that's okay too. If you're in the office, can you do a lap around your office floor? Something that's short, 2 minutes or less is generally what they consider the snack, the length of the exercise snack. Because you can probably do anything for about 2 minutes. Can you have periodic exercise snacks throughout the day to slowly increase your total physical activity throughout the day? Even if it's can you just go up and down the stairs once in your house? And if you are limited with your mobility, you don't have to necessarily get up. If you have bad knees or hips, do you have some cans of soup? Do a couple bicep curls or tricep kickbacks from your chair. If you like the exercise bands, can you do some exercises with those? Just a couple reps. Because again, any sort of physical activity that you can squeeze in, truly, you'll see more benefit in the long run. I hope that answered your question appropriately. Just giving you ideas. Whatever exercise you like within that that snacking period. What can you do for 2 minutes or less? And do it a couple times a day.
Well, keeping in mind the time, we're at the end of the hour, so I don't think there are any other comments in the chat right now. So I just want to thank you, Kate, again for a great presentation. It's very, very informative, and I hope inspirational for people at the beginning of the year when we all have our New Year's Eve resolutions. So
yes, exactly. Yep. Plan rest into your resolution. Again, my email is at the bottom. Feel free to email me, and Mary, if someone reaches out later and asks for my email, feel free to give it to them too.
Okay.
Thank you very much for the opportunity to talk to you.
Take care.
You.
Thank you.
Thank you. Very nice.